Hi, everyone. This is Dwight Schuler. We are going to wait just a few minutes before we start our first web broadcast of the year. So it'll be a few more minutes and wait for a few other people to join, and then we will start our presentation. Hi, everybody. This is Dwight Schuler. I'm going to be presenting today. Just waiting another minute or so to allow other users to join, and then we'll get started. Thank you. Okay, it's almost 2 after. We're going to go ahead and begin the presentation. Hope everyone is doing well. My name is Dwight Schuler. I'll be hosting the presentation today and presenting for you. So our presentation we have today is the prepare for the 2001 first quarter items with the COVID vaccination setup and the 2021 E&M coding workflow. So I'm going to go ahead and start the presentation, and just want to let everyone know that all attendees are in listen-only mode, and the recording of the webinar will be sent out to all attendees after we're completed. Maybe a day or so, but you'll be getting a recording of this webinar. So going to move on forward here. So if you have any questions or inquiries, this is where it would need to be submitted within the questions section, this window that's showing on the screen. All right, so a little bit about EMedApps. EMedApps is a healthcare information technology services company providing practices, clinics, and hospitals with a full range of services, as well as a suite of products designed to increase efficiency and facilitate communication. We were founded in 1999. We're working as a partner of NextGen since 2001. We work as a subcontractor for NextGen, and we're serving healthcare clients all across the country and services and products for NextGen clients. If you have any further questions on any other details of that, we would be glad to answer those questions as well. You can follow us on all the social mediums. Be sure to link up and follow us on Instagram, Facebook, YouTube, all the others. A little bit about me. Sorry to bore you with this part. My name is Dwight Schuler. I've been with EMedApps for 5 years now. I'm an application specialist, and I have over 15 years of experience in the healthcare industry. When I'm not working, I enjoy hanging out outdoors with my kids, coaching their sports teams, and working on home projects. Unfortunately, there are too many to get accomplished. In the picture there is my daughter and my 2 sons, Taylor, and then Austin's the one with a little lizard on him, and Andon's the one pitching. So I'm very fortunate. Okay, without further ado, let's go ahead and get started with our presentation. So the first part I'm going to take you through is the COVID vaccination and configuration. with the COVID-19 vaccination, we're going to show you how to configure it, and then the process and workflow for administering it within the orders immunizations module. So what I'm going to do is break down for you the different areas that need to be touched on and addressed in the build, and then I'll take you through a demo. Now, wanted to let everyone know, as far as for demo purposes, with the weather and whatnot, we're having a little issue with our sandbox or our environment that we're showing in. So there could be a little bit of a delay there. So I apologize in advance for that, but we'll try and make it work so you can see it. If not, then once things clear up, I can even do a little workflow recording, and maybe we can send that out to all the attendees as well. Okay. So COVID-19 vaccination information. So I've been on a few phone calls and communications with NextGen, as well as some of my clients that are already implementing implemented this, the COVID-19 vaccination. They've already set it up and they're administering the vaccinations in their clinics. So I've learned a few things along the way. As everyone knows, with Operation Warp Speed and everything that's going on in the world today, things are kind of in a steady influx and change. So, our goal here is to try and narrow down what you need to do for this COVID vaccination. So as you can see, a couple things you're going to need to have. One is you're going to need to have the medication update that was distributed on 12/20/20. So December medication update. It was released on 12/11 of 2020. That's just a typical medication update. They're usually distributed about every 2.5 months. So you need to have that because that includes the information that you need for the Moderna and the Pfizer vaccinations. It'll contain all the data. You'll see it in the environment. If you don't have that medication update, you won't be able to select in the vaccine inventory either of those medications. And then something that I wanted to go ahead and let everyone know that we've talked to a couple healthcare organizations, and this was kind of a lot of questions they were having to field, was the doses 1 and 2 of the Pfizer and Moderna vaccine. It's the same vaccination. So it's essentially like any other first dose of a vaccination and then a booster is essentially what it's going to resemble. So break down a few things about Pfizer and Moderna. So the Pfizer COVID-19 vaccine was approved by the FDA on 12/11 of last year, so December of last year. And it's obviously a 2-dose vaccination. And the vaccination is from dose 1 to dose 2 is 21 days, so 21 days apart from your 2 doses. Moderna COVID-19 vaccination was approved by the FDA on December 18th of last year. And that vaccination is also 2 doses, but in that case, the Moderna vaccination can be given from dose 1 to dose 2. It's 28 days, 28 days apart for both vaccinations. All right. So some other patient-specific information we wanted to include, and the reason that this was kind of included is for the staff that are administering the vaccination to patients. If they get questions or things of that nature, these are a lot of the questions that I've received from my clients and other clients that I've worked with, and other things that have been posted to the NextGen community. So I wanted to cover a few of these. So for patient-specific information, once again, this is just answer any questions the patients may have, just to help comfort them during these times of getting the vaccination accomplished. If your first dose is Pfizer, your second dose should be Pfizer as well. The same thing applies to Moderna. So if your first vaccination is Moderna, stick with Moderna throughout the entire course of both vaccinations. You really don't want to switch manufacturers in this case. It takes an average of about 2 weeks after each dose for the body to build up the immunity that is needed. So, obviously everyone is still wearing their masks, and that's pretty much a mandate across the board. But just to let you know, in case they ask that question, if you're late for a second dose with either of the vaccines, you should still get it. And that is solid advice. If you're a few days late, you're still going to want to get that second dose as a booster. Better late getting it than not having it at all. Do not just get one dose. It is important to get both doses, and I'm sure that everyone in the healthcare community would agree. Each state is basing their plan off the federal government plan of Operation Warp Speed and getting all the vaccinations out. Well, but each individual state has some ability to bend and adjust things to their state's individual needs based on logistics or whatever it may be. And then I wanted to put another note in there. I know there's two vaccines that are being mentioned quite often, the Johnson & Johnson and then the AstraZeneca. So the AstraZeneca vaccine is the next one in the queue for the FDA to provide emergency authorization and approve. That vaccination is also a 2-dose vaccination as well. So if you have any questions like that, if there are others that apply, feel free to put them in the question window, and we'll try and answer them the best we can, or we'll answer them with a further email down the road. All right, so the first part, so for the nuts and bolts, what I'm going to go over now is configuring the COVID-19 vaccine. So the first step is to go into vaccine inventory. So what this is doing, these slides here, is going to show you pretty much where you want to go and what you need to fill in. And then I have some screenshots in addition to kind of where you need to go and then what you're going to see on the screen. For anyone that's added or updated vaccinations, and taking care of vaccine inventory, then this will all look familiar to you. So first things first, we want to select EHR master files, which is just the EHR selection on the far left in file maintenance. And then from there, you're going to select vaccine inventory, which is listed right here. Once you select vaccine inventory, it's going to show you all the vaccines you have in your system. Well, from there, what we want to do is hit Norton New. So you're going to hit the Norton New button. And then the best way to do this that I found is to select the medication description in the first column at the top to sort everything ascending, and then just scroll down. Unfortunately, you can't type ahead, so you would just scroll down, find the Moderna vaccination or the Pfizer vaccination. You would see that here in the CDC vaccine list at the top. And then from there, once you click on the actual vaccine listing, then below you will see the items populate. So the areas that you will need to fill in are listed here, and where it says enter the following. So you're going to enter in your vaccine name. You can enter in anything you want there, whatever is easy to identify for your staff. Okay, I've seen Moderna vaccine, I've seen COVID-19 Moderna. There are all different kinds of selections that you can make, and that's fine. It's totally up to you to decide. So you're going to enter in the vaccine name, as it says over here. You're going to enter in the strength. You're going to enter in the quantity, and then the unit of measure, milliliter, will show up for you. And then the route's going to be intramuscular, and then the brand name will be filled in. You can actually adjust this value here if you want, but normally it's listed here in the vaccine name. Okay, manufacturer's already filled in, so you don't have to worry about that. Then the next step is after you enter in your route, you want to enter in the lot number. That's the next open slot here that you can enter. And then the lot number, it's usually on the package. Now, I will say that for registries and for logistical and data integrity purposes, I would definitely say to not change the lot number, and it's something that NextGen is trying to push as well. Don't change the lot number, putting extra digits or extra values in there, because then when everything is uploaded to the registry, it's just going to cause a lot of data integrity errors. You'll see your NDC ID. It should automatically be filled in. My recommendation is to take that, copy it, dump it into another document and have it saved. And then that way you would be able to cut and paste it into the NDC library when we get to that step. Okay, then you have your starting unit, so how many ever units you received within your allotment, and then the total component should be 1, and you want to fill that in. Once you enter in your starting units, you're going to see the available units calculated out as well. So if you have 40 starting units, available units will show 40, and it'll be 0 units used. As you use up your units, this number will go up for the units used. The expiration date. And the expiration date could be on the packaging, and if not, you're going to want to enter in the end of the year, so 12/31 of 2021. That will give you plenty of time to be able to use up the allotment of vaccinations that you have. Also, there wouldn't be a message saying that the vaccine has expired when you're administering the vaccine. The last part that we want to touch on is the ICD code and description. If you hit this little question mark here, it's going to bring up a selection choice, and you would just punch in Z23. Z23 is the encounter for immunization. If you click on that, when you're in the orders module and you select your COVID-19 vaccination, it will automatically attach the Z73 to the administration of the vaccine. to that encounter. Okay, down at the very bottom here, you have practice and location. If you want to narrow down specific locations for specific lot numbers, you can do that. I don't have that built in the system because it was going to take too long to show. If you have further questions on that, I can even provide further information. But what you could do is within here under practice, if you click the drop down and you choose one of your locations, let's say for example you have 4 or 5 locations and you want to do lot numbers for specific locations, then you narrow down which locations have those lot numbers as you build this. And what this will do for you is only show the lot numbers for those specific locations that are built. So that way, if you have 2 different sites and you have 2 different lot numbers, you can build the Moderna vaccine for either site and build it in here essentially twice, and then narrow down the locations to specific locations. And then that way there's no confusion with the staff as to what lot number to select. Okay, the next step is this configuration of the CPT4 codes. So once again, we're going to stay in the EHR file maintenance in the system master files. We're going to go ahead and select CPT codes. And then from there, we're going to hit Norton New. So what you see here is a screenshot of your essentially with the screen in behind the CPT4 code search is going to be the first screen. If you haven't built these, then you're going to need to build them. Go ahead and hit your Norton New button. And then it brings you to this screen right here where you add in your CPT4 code. In this case, you would go ahead and punch in your code. So for this example, we're using the Moderna 91301, and then you can put in your description whatever you'd like. I know that in some of the documentation that NextGen is distributed, there's specific things that they have typed up, but this is all up to how you want to have it documented. I would say that when you're doing the administration codes, definitely want to differentiate between the first and the second doses. So as you go in and you punch in your CPT code, you punch in your description, the type of service, you can always enter medical care from the drop down, and then you can put a note in here, SARS-CoV-19 or whatever you'd like. This doesn't show up anywhere, it's just for your own purposes. So then you would just hit next and move on to the next one. The next screen I have here is showing you the first Moderna dose administration code 0011A, and what I did was I entered in the administration of the SARS-CoV vaccine, and then I have at the very end first, and then I put in my notes that it was just a first vaccine administration first dose. Okay. And what you would do is you would continue to build both the Moderna and the Pfizer in your system, and that would be 6 total entries you'd have to make. Okay. So the next section is the configuration of the SIM library. So for those of you that have entered in SIM codes before, it's pretty straightforward. But for instructional purposes, you enter in the SIM library. So we're going to select libraries within file maintenance, and then we're going to select service items. You're going to want to select your default service item library. And then when you get to this screen right here, none of this will be filled in. You're just going to hit the Norton New button. And what it's going to do is it's going to clear everything out, and then you're going to hit the question mark here, which selects your CPT code. Once you select your CPT code, then you can go ahead and fill out everything you'd like. So you select your CPT code, for example, 91300. It's going to drop in the service item number here, and then it's going to drop in the description that you built within the CPT4 code documentation that I just showed you on the previous screen. The only other 2 areas that you need to worry about. So once again, we have the CPT4 codes here. For Pfizer, it's 91300. For Moderna, it's 91301. Then the only other 2 things you have to fill in are the component, which is always going to be global. You can enter global in here. That's a drop down. It gives you 3 choices. Just make sure you select global. And then you're going to enter in your effective date and your expiration date. So for example, for the Pfizer, that was released on 12/18. 2020, I'm sorry, 12/11/2020. So for that code, you would want to enter in the effective date of 12/11/2020 and the expiration date of 12/31/2099. And then you've completed that entry. You would just go down on the bottom and select next. Then you would repeat that 6 more times. Obviously, 2 for the 91300 and 301 codes, and then the 4 others would be for the Pfizer and Moderna administration codes of the 0001A and 0002A. and the Moderna of the 11A and 12A. And I wanted to mention, and I'll show you, you'll see in the demonstration, when you do select this code, if you want to have in the service item library, if you want to have it show up differently than, say, for example, 0012A, you can type in here whatever you want in the service item number. So you can list it. So for example, 0012A would be Moderna 2. 0011A would be Moderna 1. If you key it in here and save it, then you would add it in the vaccine administration billing. And that's what will show up in the orders module. When you give the immunization, it'll show up as the administration code. And I'll show you how that's going to work for you as well. You'll see it in the demonstration. Next step is the NDC library. So the NDC library is what we're going to use to uniquely identify the vaccination, right? Each of the vaccinations have their own NDC codes. So you're going to stay within the library's area of file maintenance. You're going to choose your NDC default, and then this screen is going to come up that you see within the presentation. So when this screen comes up, you're already in the column for NDC ID, and then all you need to do is scroll down to the very, very bottom. So scroll all the way down the bottom, you get to the first line item that you can actually, sorry, I hit the screen. You get to the first line item that you can actually enter something in. Double click in that first column for the open entry. Once you double click there, then you can go ahead and enter in, and that's what I was saying before, you can copy your NCD NDC ID over to a document. You can just cut and paste it right in there, and then you would enter in your CPT codes and your effective dates, which is everything that you've entered in so far. The CPT code, for example, the 91301 for Moderna, and then the effective date of 12/18/2020, expiration date 12/31/2099, and then your description is up to you. You can enter in what you would like. You could do something to identify the difference between Moderna and Pfizer, so COVID-19 space Pfizer, COVID-19 space Moderna. Your drug unit price is 0, and then your unit of measure is going to be milliliters. So you would just hit the drop down arrow there, or you can just type in M in the field, and if you hit M twice, it will actually go ahead and drop it to milliliter for you. And then the drug count is always going to be 1. As you can see, we have those items listed there. All right, on to the next step. Configuration of vaccine administration billing. So this is where you go into the EHR master files within the system, and you're going to hit Norton New. All right, and this is where the screen is going to take you to. So within file maintenance that I was showing you before, there's a vaccine admin billing. Click there. It'll pull this screen up that'll show you everything. You go ahead and click your Norton New, and it's going to bring you to the SIM code selection here. Once again, this is the same SIM codes that we entered in. So in this case, if you entered in, instead of 0011A, you entered in Moderna 1, this is where you would type in that. Okay, so as you can see, these are all the listings as it's done, kind of straight arrowed without the different naming conventions for the administration codes. And what you would do is you would hit the yellow envelope here, and you would open it up and you would punch in your codes that you've already created. So I show you kind of an unfinished version of it here. I have added both the Moderna administration codes, and then I've started and showed you the process of adding in the Pfizer administration code. Okay. Once you complete all the 4 codes, no matter what you have them named, add all 4, hit OK, and then you have it listed as for your vaccine administration billing. All right, the last thing that we need to do is we need to make this available to our staff in the immunization module from the test tubes in the order module. So what you need to do is you need to make this available. So you're going to go into practice preferences. So you're going to select, once again, the EHR master files, and then we're going to select practices. We're going to select our default practice. And then you'll, for those of you that have been in practice preferences, you would hit the preference button. It would take you to this screen right here. So in this screen, on the preferences list on the side, we want to go ahead and select orders module. It's going to open up with this screen for us. Okay. We then want to select the tab for immunization. Once you select the immunization tab, you'll have some different choices in the bottom. So I've directed you to to enter in adult for favorite category. So if you hit the drop down here, it'll show all the different favorites that you have to select from. And in this case, you would choose adult. Once you choose adult, there's going to be a grid below. And then from there, you would just go in and add the grid, and it would show you this window right here, updating your favorites for the category adult. And what we're going to do is you want to punch in the CVX numbers for whichever vaccine that you're administering. And if you're administering both, you would add 207 for Moderna, and for Pfizer, you would add 208. Slide them over to the right, hit OK, save everything, and then you will see that selection within the orders module. So what I'm going to do now is show you a real quick review with the demo here. So the idea here is to run through and show you kind of the different areas that we just hit upon. So as once again, because of the weather and whatnot, the connection may be a little bit sluggish, but here we are in the file maintenance and all the build areas. Okay, so this is where I was talking about with vaccine inventory. So if you click on vaccine inventory, and I hope we don't have to wait too long. Hey, there we go. So you can see I've already built them here. If I haven't, and I've already built Moderna and Pfizer down here at the bottom. So we have Moderna right here. If you haven't built them and you need to build them, then this is where you would go into new, and you would hit new. You would open that up, and this is going to bring up all of the selections that you have. Click on the medication description, and then you're going to have to scroll down to where you find Moderna or Pfizer. Okay. And from there, it's just like what I discussed earlier. Select it. These are the areas that would need to be filled in. And then this is the location area here. One other tidbit that I wanted to point out, if you want your vaccine admin codes to show up, then you can add in a vaccine admin code here specifically. It's kind of hard. The problem is for vaccine administration of one, the first dose, it's one administration code, and it's a second dose for the other administration code. I've had sites that automatically have defaulted in the first one, and then if their staff knows it's the second dose, then they just go ahead and change the admin code. If you don't want anything to default in, it's just going to default in with the standard 90471. Okay, but this is where you can go and you can add in your admin code that you want to override to always show up for the medication, in this case Moderna, that we selected. All right, so I'm going to go ahead and close out of there, not save my changes. And we're going to go on to the next area that we talked about before. So in the next area that we discussed in our presentation was the CPT-4 code. So once again, I'm going to show you the skeleton of how we would do it. So in this case, I have everything already built, but if we wanted to, you type in your 9300, which is the wrong number, so 91301, you see it would automatically come up. If it didn't come up, obviously, then you would hit new. And this is the screen that is in the presentation. Enter in your code, your description, and then you can just hit the drop down, type in M, and it'll generate your medical care. You do that for each 6 entries, the 91 codes and the 00 administration codes. Okay. Close this out. And then the next step we talked about was the SIM library. Once again, we go over to libraries. So you click on libraries over here in the screen, and then you have your SIM library, and you also have your NDC library. So real quick, just going to show you, you select your default library, open this up. It's going to then bring up your screen that shows your SIM entries, and you can actually go straight from here. If you know you haven't built them, click on new, and everything's going to show up red that's required. And this is where you would hit your question mark, and then you would punch in the code and you can pull it in. Earlier, what I talked about, if you wanted to make this say Moderna 1 or whatever, if these are one of the administration codes, you would just change that entry right here and you would just type it in. Now, this is obviously the actual CPT code, not the administration code. So if it was the administration code of 0011A and you wanted to label it Moderna 1, you could. And I'll show you that in the demonstration as well, because I've given you both options in my build. Okay, so we're going to close out of the SIM library and we're going to go over here to NDC. NDC, once again, was just like we talked about, default NDC library. You select that. It's going to bring up the NDC library. It's loading the form for us. And then this is where you would scroll all the way down the bottom. You're already in that first column, right? And then this is where you can go in, you just double click, and this is where you would cut and paste in your number, okay? And I actually clicked the wrong one. I clicked a tab. So we're gonna go back real quick to the NDC. So this is where you double click and you would enter in your information here, which if you cut and paste it in, and then you continue to go over to the right, filling in all the information that I had identified. I did want to show you up at the very top what I have. So here's the information that I have already entered. I just cut and pasted this in. So obviously this is the visor because of the 12/11 effective date and the 91300 CPT code. And then we have the one for Moderna of the 91301, and that's built out for you as well. Okay. Sorry, I'm going to hit cancel. And we're not going to save. Okay, so we've covered the main parts of those entries to make the vaccine available for your users. So now we're going to go back to the EHR. There's one last area that we need to touch on, the vaccine admin billing. Vaccine admin billing is listed here. You click on the vaccine admin billing link, and it's going to open up the vaccine billing. And you may see more than just these codes. I just have these codes built for us. Once again, instead of entering in the 0011A, this is where I have it now set as Moderna 1. I have the other 001112A, which is the second dose for Moderna. But I wanted to show you, this is in conjunction with the SIM library entry, and you pull this code in, and these are the codes that are going to show up when you see your administration code. All right, so the final part was the practice preferences. You go into practice, and then you can pull up your practice preferences by hitting the preference button. So you would pull in your selected practice, and from there we're going to pull up our practice preferences by hitting your preference button, which is coming up for us. Once again, sorry for the little bit of a delay here. Then you hit your preferences button, which is located down here. Sorry, I'm going to shrink this down for us. And you hit your preferences button, which is loaded up right here, and then go on from there. For the sake and argument of time, I just want to make sure that we get everything covered because we have the E&M codes to cover as well. But this will load up now as soon as I say that. So we're going to see our preference button there, and that's where you're going to go ahead and select preferences and move on and add in your CVX codes and selections. Okay. So I'm going to go ahead and cancel out of here, and I'm going to move on over to the EHR. All right, so within the EHR here, I'm already set up for our immunizations. How I got here was just hitting the test tubes down at the bottom under the patient history bar, and then I went ahead and it'll bring you up the results. Select immunizations. As you can see, this patient has already had the first Moderna entry. So what I'm going to do is just go ahead and add in the second. Obviously, they would be, in this case, it's the COVID-19 vaccination. I know that's Moderna because I put it in there, so this be 28 days apart. We're going to go ahead and hit the new to create a new order. And I'm waiting for that to come up for us. Fingers crossed. And you're going to see the screen here where you can select your medication. And once again, hoping it's going to come up for us. It looks like it's trying. Once again, everybody, sorry for the delay. There we go. So in this case, we're going to go ahead and choose our entry for COVID-19. We click on that entry. It's going to open up the review allergies. I did want to show you real quick, sliding that down. There are the two differences, right? The 91301 is Moderna. The 91300 is Pfizer. Okay. We're going to hit no to no known allergies. Select save. Now we can go to vaccine details. This is where the Z73 comes in, your diagnosis code there. that I mentioned before. We're going to go to vaccine details. And then from here, we would select our lot number. This is the lot number that I have for Moderna. We're going to click that. And now if you notice, I have Moderna 1 automatically come up for us. So to the billing side, it doesn't matter. It's still going to bill out the right code. But this is just on the admin billing side, being able the user to know that it's Moderna 1 or Moderna 2. We already know that the patient's already had a COVID vaccination, so we're going to go ahead and choose a second one. So I wanted to show you, if you hit the drop down, you're going to see the different selections. So if you wanted to do, instead of 0012A, you could do Moderna 2, you can do that. But in this case, we would hit Moderna 2. We have to select our administration code, and then if you wanted to enter any comments, you could, and you can hit save, and that will do it. You now have administered a COVID-19 vaccination. One other quick area that I wanted to touch on and cover for everyone is the reason that you want to have both Pfizer and Moderna created is in case a patient that you're seeing has went somewhere else and gotten the COVID vaccination shots. And if that's the case, then you can enter in a historical entry. If you don't have both entered, you're not going to be able to enter in either or. So in this case, you could say, once you click, just like any other historical entry, once you click on the historical entry, plug in the date and the source, and then you hit save and close, and it'll document that the patient's had that vaccination. I'm going to go ahead and close out of here. And I'm going to go back to our presentation real quick. And we're going to go into the next section once I touch on these couple things. I mentioned this earlier. Do not adjust the lot numbers. The extra characters are causing some issues with registries. You want to make sure that we're not causing downstream data errors, especially for tracking this and whatnot. This is a big effort across the country. So you want to make sure that you leave the lot numbers as they are from the packaging. And then I just showed you the historical entries for the COVID-19 vaccination. So you want to make sure that you have both built so you can actually go in and enter in historical entries for any of the patients that have gotten the vaccination elsewhere besides your practice. All right. So on to the next, we're going to talk about the 2021 E&M coding workflow. This is not really huge if you're a 5.9/2020 version, but if you're not, then there's a little bit of difference in the workflow is what you're going to see. So once again, as I was just touching on, the E&M coding information. In the 5.9/2020 spring release, basically, based on the medical decision making, the code is automatically calculated. You don't have to hit calculate code anymore. That should be grayed out for you if you have everything implemented and it's correct. And then if you want to, you can overwrite the code. There's nothing that says you can't do that. If you feel like the 99213 is not accurate, then you can change it if you like. I know a lot of times I like to stay with those codes, but there are different variables that could affect that. So in the spring release, it's all built in. You don't need to leave the finalized template. Everything is great. In the pre-spring release, so this will be a 5.9.3, 8.4.3 or earlier version, there is a pop-up that comes up. All it's doing is when I say leave the finalized template, instead of clicking everything on the finalized template, it's just going to be this pop-up that's going to come up for you. Now, the nice thing about this is it saves you a step with not having to select the medical decision making. Your workflow would just be go down in the finalized template in the E&M coding piece, and you're going to select your calculate code button. It'll automatically bring that pop-up up, and you can actually enter in your allotted time and or your medical decision-making selection there. It'll calculate the code for you, and you can go ahead and hit accept and move on to submitting your code. So I'm going to take you through real quick a couple little things that I wanted to touch on, and then we're almost done. So within the practice configuration template, you're going to want to set the date here, which is the 2021 coding guidelines effective date. So if you enter in this date of 12/31/2020, then any visit or any encounter after that is going to have, after that date, so January 1st, 2021, is going to have the new E&M coding workflow attached to it. So everything that I was going to show you really quick will be how it would happen. Now, this was supposed to be done at the beginning of the year. I know that there were some situations that it didn't take place across the board. So in this case, whatever date you enter in here, the next day, it's going to start using the 2021 E&M coding guidelines from the AMA. And actually, NextGen provides a setup document to complete the build. I did that for a few of my clients. And then we had a colleague of mine get really creative and make this happen really quickly with a solution. So for all of our hosted clients, which was great. But there's a setup document guide that I've attached to the presentation that you'll be able to pull down. Okay, so this is for the 5/9/2020 spring release. You pretty much don't have to leave this area here. As you click on your medical decision making, or you enter in the total time that you spent with the patient, it will then calculate your code down below, and it'll apply the visit code based on which decisions you make as a medical decision making or the time allotment. Okay, and essentially the three factors are: is this a new or established patient? What was your medical decision making selection, and/or how much time did you spend? That's what dictates what is going to happen as far as the code that is going to be given. Okay. So for the 593.843 or below version, an earlier release, there is an additional pop-up that is created. It's called the E&M 2020 Guidelines pop-up. When you select the Calculate Code button, the users will see this pop-up come up. Now this pop-up functions just like the Finalize in the spring release does, based on if it's a new patient or an established patient, and based on your medical decision-making value, it would give you this code. Or if you didn't select medical decision making and you were allotting time, based on your time entry, it's going to drop the code for you here based on the amount of time that is identified within each of the codes. It's going to give you that code, then you hit accept, and you've completed the visit. So real quick, I'm going to show you in our system the spring 2020 version, and then we can open it up to questions. So I've already got it preloaded for us just in case things were a little slow. So this is the 5/9/2020 version, as you can see. So we've entered in our information here. We're going to go down to where we see the evaluation and management coding. And this is where, as you can see down here, watch the code as it changes. So if it's moderately complex, it's going to change the value to a 99214 and 99214 here. For example, if you think it's highly complex, then the high complexity, then you're going to see the 99215. Now, if this was a new patient and not an established patient, then it would be entering in these values here. I also do want to show you that if you enter in the time value here, and let's say that we enter in 50, let's say we enter in 40 minutes. We're going to go ahead and enter 40 in, and as you can see, as soon as it calculates, it's going to give you the established visit code that falls into this time range. Anything over 54, it's still going to give you the 15. And then obviously, if it was a new patient, it would select these here. You hit your submit code, and you're done and on your way. Okay, since we only have this environment, I won't be able to demonstrate the pop-up coming up, but the pop-up coming up works the same as this does. The pop-up will include these values. As you click those, it'll fill in just from the screenshot that I showed you within our last slide. All right, on to the last little piece. So in some additional documentation that I wanted to make sure that you had at your fingertips. The NextGen Success Community web links. I've linked in for you the COVID-19 Resource Center. I'm sure that anyone that's been working in NextGen since COVID hit is familiar with this link. There's a lot of good information in there. It pretty much answers all your questions. And you can get to your medication update and all of those things if you haven't now put that in at this point. There's also a few other helpful links, the Pfizer fact sheet and the Moderna fact sheet. You can use these as your VIS documents. For anyone that's still using VIS documents, all you would need to do is pull these down, and then you can save the PDF within that VIS document section in the NextGen root and link it up just like your flus and other DTaP, all those other type of vaccinations are listed in there. Put it in the same place, and then you would go in and build it within the VIS settings and file maintenance, and you can link this as your VIS document. And then down to a few things for the 2020 E&M coding. I worked with my colleague to pull down a couple of good documents for you. The AMA is the one that really streamlined this, so there wasn't a whole lot of extra work involved, where if you select the medical decision making or a time allotment, then it's going to give you your coding. Well, there's a few links here that describe how and why they came to that conclusion. And then this link right here is the information on the level of medical decision making revisions. That is the same link that you would see in NextGen. And let me show you that real quick, since we're a little ahead of where I thought we would be. If you see here within our, so this view MDM guidelines, that link that I'm giving you on the presentation is the same. That's the same exact link that you would see launching it from there. And then there's also a 2021 E&M coding update documentation pre 5984 spring release. All right. And what this is the guide to how to go about installing and building out everything to make sure it applies to the documents and whatnot. Okay, that concludes my my part of the presentation. And as I said before, there's going to be a recording that we're going to send out. And then if we have other questions that are specific in nature about how to identify or build something out, or if you have questions even further, obviously feel free to reach out to us and we'll field those questions. I can even get on a go-to meeting, or we can discuss and chat further, or I can hop in your system and help you work out those details. All right, well, that concludes my part of the presentation. I'm now going to open it up to questions and answers, and I would believe Alexis would be able to jump in now and let me know if there's anything that was sent out.
Yes, Dwight, and as of right now, we do not have any questions, but we can give it a second and see if any come in.
Oh, well, that either means I bored everyone or I explained everything.
We'll go with the latter.
Yeah, hopefully, right? And once again, reach out to your salesperson too, and if they need to pull me in and we can hop on and discuss anything with you, I'd be glad to do that and help our sales staff answer any questions. And or, like I say, I love jumping in and helping my clients and several clients across the country to build out and make the system a lot more usable and user friendly for everyone. So look forward to helping you out.
Okay, and still no questions, so I think we can go ahead and end it here. And if any come in after this, we'll be sure to include them in the email that we send out with the recording, webinar, and slides.
Wonderful. Thanks everybody for attending. I appreciate your time today. Stay safe.